So today we wanted to kind of give you guys a peek into our work bags.
Yes.
We have them here. They're
big
so
bags.
Anyway, so we take these bags with us for every single shift. So we wanted to kind of show you guys our little, I call it my survival bag.
Yes.
Because
definitely.
I have to have it.
I call my must-have bag. Everything in here I must have.
So I guess we could start off with the front pocket. Generally in my front pocket I like to put like the things I need to get to right away. So obviously that's my hospital badge, which for obvious reasons I'm not going to throw up there. I love to keep a dry erase marker for the board for when I go and write on my patient's board and tell them who I am and that I'm going to be with them. Literally 1, 2, 3, 4, like all of these pins, because you never know when your pin is going to get jacked. Like, you leave it on your wow and you leave and you come back and it's gone. So I like to have a lot of pins. A pair of scissors. And that is pretty much everything in my front pocket.
Well, that's a lot.
What's in yours?
The only thing I put in my front pocket is a pack of gum. So, I mean, you're not using the bag, you're using the front pocket.
Whatever.
So yeah, extra gum I keep in my front pocket because you never know when you want to just chew some gum for a minute.
Yeah.
Yeah.
Okay. So what I love about this bag is like it has so many pockets on the inside.
1, 2, 3, 4, 5, 6.
Kind of show. It's like
6.
huge. This is a perfect bag to use for what I use it for.
I love all the different pockets because I like to keep everything organized. I don't want to have to like scurry through to find what I need. So she had all of her pins on the outer pocket. All of my pins are in the inside pocket. My pins and dry erase markers and everything. Again, I have a lot of pins too because pins do get stolen all the time. Yeah. I even have an extra pack of pins. I like to stay stocked up on pins. Every nurse does. Yeah. I'm still pulling them out. Okay. I think this is it. This is all that I have.
Well, in my pocket, the first one, I have all of my highlighters because I like to like have them in my pocket if I'm getting a report and the nurse says like something that really needs to be done or something I really need to know about the patient, or if I have the same patient from the previous day and only a couple things have changed. Updates. I like to use like these highlighters and that draws my attention to the important stuff right away.
See, in my next pocket I have calculator. And this is actually my calculator from nursing school. I don't know. I don't know. Also a pin light. Neuro checks and everything, you know. And then I have scissors. I'm supposed to have scissors. I wonder if someone took my scissors. I'm supposed to have scissors in this pocket.
Alright, so I have another pair of scissors. And then I have a charger for my phone that I use only at work. It's nothing like fancy, you know, just in case, because sometimes you never know, stuff does get misplaced. So it's nothing too fancy, just something that will charge my phone if necessary. And then these super cute Barbie Band-Aids.
Oh my gosh.
Like, randomly I'll get like a little cut or something. I don't like to have open cuts in the hospital, so I'll just run and get my Barbie Band-Aid in my bag. And like, patients love it. They're like, oh, you're so cute. You have a Barbie Band-Aid on. That's all in that pocket, yeah.
Okay. So my next pocket, I have these absorbent, like if you're running around and you get kind of oily, like blot pads, I have those. And then I have Mentos mints gum, it just depends on how I'm feeling. I also have my badge. Yeah. And then I have an extra badge clip because sometimes the badge clip just goes wrong on you and then you're stuck with your badge hanging like all the way down to your waist. So I learned my lesson and I keep an extra one just in case. Yeah. And then I have baby lips to keep your lips nice and moisturized. I love this stuff. Like, it's amazing. That's all that's in my second pocket.
Well, I have like some of the stuff obviously we have the same, so I'm not really going to dwell on it, but just like this little pouch from nursing school, I've got my pen light here, my scissors, and some more scissors and calculator. If you can't tell, I love to have my scissors. My pen light. Yes. Here we go. I think it's so cute. I got it because of the color. So. And then I have another full pack of highlighters because
why not?
And they're cute.
Alright, so my next pocket. I love having snacks on hand. So I always have like these little fruit snacks, the Black Forest fruit gummies. They are so good, and you could just like throw a pack in your pocket and just like pop a couple in your mouth just to give you like energy. So I always have several packs on hand.
Do you guys remember when we did that Dollar Tree haul and I found those birthday cake, or was it cotton candy? I think it was cotton candy flavored candies.
Yeah.
Well, I went back and they had birthday cake flavor, and so first of all, it's only open like this because I'm sure there was like an emergency going on, and like I was gonna open it normal and a patient was like, help! And so like that's why I had to like rip it like that. But
okay.
So I just have like some of these in here. Put that away. I also have a bottle of water because I like to keep like a bottle stocked because I never know. You just never know when you're gonna like get thirsty or dehydrated. So I always try to have a bottle
nice and hydrated. You have to take care of yourself.
I have like a pocket that's designated for my pretty colorful pens because like I used to like use these for like charting my care plans, but then like I got in trouble once because the manager was like, who's charting in pink? And I was like so I had to start using black, which is no fun, but you know, people try to take your personality away, you know. Policies and stuff.
Party section, of course. Main thing every nurse needs, nice clipboard.
Yes, I still even have stuff on mine.
Yeah.
Like, but you can't, yeah, like mine is not so much functional like as hers is probably, but
yeah,
it's pink.
Yeah, she likes that one because it's pink, but I like this one because like there's a, let me lift it up, a notes section. So if you're like doing something with the patient, you know, you can write on the front, but if it's something important, you could just open that up, jot down those notes, and it's very handy for later. And I think the pattern is cute and it matches, so. And you can change out the notebook if you need to. So I like it. It's very handy.
Well, I wanted one that was like this material because I wipe down my things with like bleach wipes whenever I'm getting ready to go home. So I had to have something that wouldn't get ruined when like I clean it off. So I've seen so many cute ones with like words and glitter, and I'm like, can't get it because don't want to bring home a little glitter and a little C. diff. That'd be nasty. What do I have in this
next thing? I have my handy dandy doctor's stethoscope.
Yeah. Which, quite frankly, is ironic because 9 times out of 10, the doctor's going to be like, hey, you gotta borrow your stethoscope.
Yeah. And we're like, just give it back. Yeah.
Could you,
they'll walk away with it.
Clean the ear part off when you're done. Like, but yeah, so we have our stethoscope.
Of course, you cannot do your job without a stethoscope. So, of course, you have that.
I have this hand ointment for like winter time because using all that hand sanitizer and washing your hands so much, like I have sensitive skin, so my hands will get very dry, and this works really well for that. So I keep like a bottle in my bag for winter time. I also have a book because on those rare occasions when we have downtime and the patients are sleeping and you don't have any meds due for a couple hours, you know, if you're not like helping out your other colleagues, if everybody's having a pretty chill day, then I like to pull out like a book and read.
On that time when you have rare downtime, I like to pull out my old Hearst book and read.
Ew, who does that?
I like this book. It's good to just like stay on top of everything. So I like to like read it occasionally. If I have downtime, I'll just flip through it and I'm like, okay, yeah, I love this information. I still have it like tabbed off from when I was studying for NCLEX, and I don't know, it's just like a fun little book.
So she's trying to make me look bad. Like, this shows our personalities. Like,
no, I'm not.
In downtime, I read Secrets of a Shoe Addict, and in her downtime, she reads Critical Thinking Skills.
Yes.
There you go. The other thing that I have in here is my emergency bag. I don't think I'm going to go into like what's into it, what all is in it, because that would just take too much time, and that's probably something for a completely different video. But I do keep an emergency bag, and so does she.
Yours is huge.
I mean, I
What's in there?
like to be prepared.
What's in there?
Maybe you'll see.
Well, I have a bunch of nice goodies in my bag as well. But it's just tiny. I think that's it for me.
Yeah, that's pretty much it for me too. So we just kind of wanted to give you guys a peek into our work bags, see what we have to make it through a shift.
Yeah.
But that's pretty much it for us. We hope that you've enjoyed taking a peek. Bye.